A government report on the mental health impact of fly-in, fly-out, or FIFO work has been released. Haven't got time to read it? Don't worry. At Vitality Works, we've gone through it thoroughly and have created this quick summary video of its key points to fill you in. Let's start with a couple of facts. Fact 1. About 9.3% of the Western Australian population are made up of FIFO workers and their families. Fact 2. Without taking into account the extra demands of FIFO work, FIFO workers are already at an increased risk of mental ill health and suicide because of their demographic. That's because suicide is the #1 killer of all men aged between 15 and 44, taking twice the number of lives than road accidents. The report finds that mental health problems could account for nearly a third of the FIFO workforce, 10% more than the national average. It's not surprising when you look at what makes a FIFO worker's life highly stressful, such as long shifts, home separation, financial worries, fatigue, work conditions, and more. The report says we can improve the FIFO system by providing tools to make people more resilient and moving away from a tough enough attitude. The report recommends some legislative changes, some of which include amending the term health to also include mental health, and the term hazard to also include psychological hazard. It is also recommended that occupational health and safety provisions apply to individuals who are off shift and residing in the facility. Other changes are to do with making sure all deaths and suicides are reported, not just those that occur when workers are on shift or on the mine site. When it comes to the Code of Practice on FIFO work arrangements, the report recommends work rosters that support mental well-being, such as 2 weeks on, 1 week off, providing reliable ways for workers to phone home, increasing recreational facilities, improving mental health literacy to reduce the stigma surrounding it, and treating workers as adults by lessening levels of control in accommodation facilities. So why should you care? Firstly, work health and safety laws require you to reduce the mental and physical health risks of workers. Secondly, research shows that every dollar spent on cultivating a mentally well workplace creates an average of $2.30 in benefits gained by the company. Thirdly, you are a son, a brother, a father, or all of the above. For every person who dies by suicide, at least 6 people are profoundly affected for the rest of their lives. So what can your organisation do about it? Here's what you can do now. Start training on mental health issues at all levels of your organisation. Increase the number of residents engaging in physical, social and mentally stimulating activities. Get the data on the mental health of your FIFO workers. It's easier and cheaper than you think. Vitality Works believes that quality mental well-being information can be used in creating positive workplaces. After that, you can introduce programs that give families insight into the daily life of a FIFO worker, consider peer and buddy-up systems, and provide a mosaic of services to help workers in feeling good, such as on-site psychologists, sound financial education, and behaviour change programs like Switched On that educate and equip your workers to be mentally well. The Switched On program helps FIFO workers in creating better habits and headspace. It provides 5 bright moves to improve the mental resilience of your workforce, resulting in less depression, stress, and mental ill health, a positive, supportive culture, and increased morale and engagement. Thanks for listening. If you want to know about the Vitality Works FIFO Mental Wellbeing Program, get in touch or visit vitalityworks.com.au.